Before you take Xanax, you need to know this. Xanax, also known as Alprazolam, is one of the most prescribed anxiety medications in the world. It works fast, can calm panic attacks within minutes, but it also carries serious risks, including dependence, withdrawal symptoms, and dangerous side effects. Today, we're breaking down everything you need to know about Xanax, uses, dosage, side effects, warnings, and whether it's truly safe. What is Xanax? Xanax is the brand name for Alprazolam. It belongs to a class of medications called benzodiazepines. Benzodiazepines work by increasing the effects of a chemical in the brain called GABA. GABA slows down brain activity, which helps reduce anxiety, stress, and panic. Xanax is considered a fast-acting medication. Many people feel relief within 15 to 60 minutes. Uses of Xanax. Doctors prescribe Xanax for generalized anxiety disorder, GAD, panic disorder, short-term relief of severe anxiety, sometimes insomnia, off-label use, anxiety related to depression. It is mainly used for short-term treatment because long-term use increases the risk of dependence. Dosage information. Always take Xanax exactly as prescribed. Typical dosages. For anxiety, starting dose, 0.25 milligrams to 0.5 milligrams, 2 to 3 times daily. Maximum dose, usually up to 4 milligrams per day. Common side effects. Common side effects include drowsiness, dizziness, fatigue, poor coordination, memory problems, slurred speech, difficulty concentrating, dependence and addiction, withdrawal symptoms if stopped suddenly, breathing problems, especially with opioids or alcohol, severe depression, suicidal thoughts, seizures during withdrawal. Mixing Xanax with alcohol or opioid painkillers can be life-threatening. What are the pros and cons? Works quickly, very effective for panic attacks, strong anxiety relief, high risk of dependence, not ideal for long-term use, withdrawal can be severe, can cause sedation and cognitive problems. Who should avoid Xanax? Avoid or use extreme caution if you have severe liver disease, are pregnant or breastfeeding, have breathing problems, take opioids or alcohol regularly. Always inform your doctor about all medications you are taking. Xanax is powerful. It works fast. And for severe panic attacks, it can be life-changing. But it is not a harmless medication. It should be used short-term and under close medical supervision. If you are prescribed Xanax, use it responsibly, follow your doctor's instructions, and never stop suddenly. If you found this video helpful, make sure to like, subscribe, and turn on notifications for more medical reviews and safety breakdowns. Stay informed, stay safe, and always talk to your doctor before starting or stopping any medication.